Bismillahirrahmanirrahim. This video will cover the introduction of the acute inflammation and differences between acute and chronic inflammation. So, what are the various steps in the inflammation? First, when there is tissue injury, it leads to some vascular changes, some damage to the local tissue, and accumulation or collection of bacteria that exert their effect by exotoxin or endotoxin and results in the phagocytosis by macrophage or neutrophil leukocytes. Then the vascular changes that occur in earlier in the inflammation, there is vasodilation and increased vascular permeability with leukocyte recruitment, and as a result there is edema. There is activation of the platelet also, adhesion of the polymorphonuclear leukocyte to the endothelial cell, that is the activation that results in activation of the endothelial cells. Then there is the transmigration of these leukocytes through the endothelial cell to the site of the injury, that is termed as diapetesis. And after these complement activation, cytokine, chemokine active factors that are released over there, coagulation cascade that is activated, they set into motion with various mechanisms of the body that result in stimulation of inflammatory cell, and as a result there is killing of the microbe at the site of the injury by the body's protective mechanism. So the basic events that occur during the inflammation are: first, there is injury that leads to vascular changes, and the key components that were involved are damaged tissue and chemical mediators, the initial chemical mediators. As a result, there is increased vascular permeability and edema that is due to vasodilation and leakage of fluid outside. Then platelets are also activated, they form clot, and there is also release of histamine. And the cells or parts that are involved are platelets and histamine. The endothelial cells also facilitate the clot formation and anchoring of the neutrophil by various mechanisms, various cellular mechanisms that we are going to study later. And the involved components were vascular endothelial cell and adhesion molecule. Then microbes activate the complement cascade, and the components involved are microbes and complement system. Neutrophils are further recruited to that area, and immune response is also activated. So neutrophil and macrophages are the major component that are involved in this event. Then final event is elimination of the microbe and tissue repair start, and the components that are involved in elimination are neutrophil and macrophages. To summarize, the inflammation steps and component can be divided into four. When the infective agent or injurious agent is recognized by the host, then there is recruitment of the leukocyte and plasma protein to that area, then there is destruction and elimination of the offending substance. And when this reaction is controlled and terminated, and finally the damage is repaired. So here you can see there is the epithelial cell lining, and it is invaded by these microbes, or there is presence of necrotic tissue that invites macrophages, dendritic cells or mast cells, and all these are there. They are responsible for release of mediators, and these mediators, they bring some vascular changes, and these vascular changes are responsible for further accumulation of these helping cells, release of the mediators, and elimination of the microbe by the help of these events. Finally, the in concert with extracellular matrix and other protein, there is a start of the repair process. So the 5 steps of the inflammation can be memorized by 5 R's. These are recognition of injurious agent, the recruitment of leukocyte, removal of the agent, regulation of the response, and finally the resolution or repair of that area. So the aim is to preserve the basic architecture that was occurred after the body was set into fire, or that tissue was set into fire. So it should revert to a more preserved or earlier structure without that was before that damage. So sometimes this doesn't occur or is not achieved. There is presence of inflammation against self tissue. There is sometimes inflammation that occur against normally harmless environmental substance, or sometimes there is flared inflammation that is not controlled properly by the body. And these occur usually in the some acute responses, some acute disorders, or some chronic disorders in which specific cells are activated or involved. Some of the examples are acute respiratory distress syndrome, in which the neutrophils are involved, asthma, in which the eosinophils are involved, in glomerulonephritis, that is the inflammation of the kidney glomeruli. The neutrophils, antibodies, complements, and monocytes are involved, and in septic shock, the cytokines are involved. In chronic disorders, some examples are arthritis, that is inflammation of the joint, and in this the lymphocyte, macrophages, and antibodies are involved. Asthma can be chronic, and the cells that are involved are similar to the acute one. In atherosclerosis, that is a chronic condition in which there is subintimal deposition, or in subintimal deposition, or in the wall there is deposition of the cholesterol, or there is development of atheroma. There is involvement by the macrophages and lymphocytes. Then there is pulmonary fibrosis, in which there is activation of the macrophages and fibroblast. So there is tissue damage and functional impairment, especially in chronic inflammation, that lead to fibrosis, scar formation, and organ dysfunction. There can be pain and disability that is due to various cytokines and prostaglandins that are released during this process. Then this can be controlled by anti-inflammatory drugs with the aim to reduce the harm and uh, keeping intact the host defenses. These chronic low-grade inflammation such as the current diabetes, obesity, neurodegenerative condition, and these are sometimes they have got no obvious symptom, hence these are also termed as silent killers. While inflammation is essential for defense, it can cause harmful effect when misdirected or uncontrolled. Many chronic diseases and metabolic disorders have an inflammatory component. I just told you, like diabetes, and the examples or types that of these harmful consequences are tissue damage, in which inflammation occur that lead to local damage due to immune cell activity, and there is presence of functional impairment and pain. Then in autoimmune conditions, immune system attacks cell tissue and result in chronic diseases. Examples are SLE or systemic lupus erythematosus and rheumatoid arthritis. Then in allergic reactions, the inflammatory response occur to harmless environmental substances as occur in asthma, drug allergies, and insect bite reaction. Then chronic inflammatory diseases, persistent inflammation contributes to disease progression, such as in atherosclerosis and lung fibrosis. Then inflammation can be associated with metabolic and degenerative diseases, and inflammation is usually plays some part in these conditions, but it is not traditionally considered, these conditions are not usually considered as inflammatory diseases. The examples are type 2 diabetes and Alzheimer's disease and cancer. Excessive or uncontrolled inflammation, the inflammation can exceed its protective role and lead to severe consequences such as occur in septic shock and cytokine storm that occurs due to overactivation of various cytokines such as interleukin 6 and TNF that can result in death. So there is sequential activity. First, the acute inflammation should be initiated, amplified, the pathogen or destructive agent is destroyed, and then this process is terminated. This is initiated by the activation of various soluble mediators and with the help of the other inflammatory cells that come to this area, and then they are responsible for further amplification of this process. And this amplification depends on the extent of the injury first. If this is a minute injury, it is over within a short time, or if it is a major injury, it is responsible for activation of this inflammatory process for a longer term, and there is activation of some mediators such as kinin and complement also. Then the agent is destroyed and the damaging agent is brought under the control. There is enzymic digestion, phagocytosis, or elimination of the foreign material or infectious agent. The debris is there, so it should be removed and clear away. And then the process of repair starts simultaneously. Finally, this is terminated and now the body tissue area allowed to repair and it is returned to its normal physiologic state. If there is a severe, a large area of the injury, the scar may be formed. If the body is unable to go through these 4 steps and the inflammation is not terminated, or the inflammatory or infective agent is not destroyed, it will undergo into a chronic process, and that is the chronic inflammation. So this is a table from Robbins Basis of Pathology, and it is differentiating between the acute and chronic inflammation. The onset of acute inflammation is fast. It occurs within minutes to hours, while chronic goes on for days and weeks and months. The cellular infiltrate in acute inflammation is mainly neutrophil, polymorphonuclear, leukocytes, or neutrophil, while the chronic inflammation is associated with monocyte macrophages and lymphocytes. The tissue injury and extent of fibrosis in acute inflammation is usually mild and self-limited, while in chronic inflammation it is severe and going on continuously. Progressive inflammation, progressive tissue injury, and fibrosis. Local signs and symptoms of inflammation are present in acute one, while in chronic the redness, flare are usually gone. The acute inflammation is also considered as part of innate immunity, while the adaptive immunity is linked with chronic inflammation. So this is the histopathological picture in which you can see that these are the polymorphonuclear neutrophils. These are the neutrophil, multi-lobed neutrophils that are present in acute inflammation. Multi-lobed neutrophils, nuclei, multi-lobed nuclei of the neutrophils, and these are present in acute inflammation in abundance. Many neutrophils are seen in this field, while in chronic inflammation there is predominance of the plasma cells, the large cell with this clear cytoplasm. The nucleus is eccentric toward a side and the cytoplasm is abundant and pinkish in color. There is presence of the macrophage also. These are the large cell as compared to these one. These are large cell with central nucleus, the macrophages, and some lymphocytes are also present obviously over here. So now to differentiate between these two, the acute inflammation and chronic inflammation, the onset of acute inflammation is rapid, while the chronic inflammation is slow in onset, while the duration of this one, it is short-lived. The acute one is short-lived, while the chronic one is a long-term, takes years or weeks uh, to be terminated. Then we have seen the primary cells of the acute inflammation are neutrophil, platelet, and mast cell, while the cells of chronic inflammation are macrophages, lymphocytes, and plasma cells. The vascular changes that occur in acute inflammation are vasodilation and increased vascular permeability that results in edema, while in chronic inflammation there is development of new blood vessel, that is angiogenesis, and also there is activation of the fibroblasts that result in fibrosis. The mediators of acute inflammation are mainly histamine, prostaglandin, leukotriene, and cytokines such as interleukin-1 and tumor necrotic factor alpha, while interferons and interleukin-12 along with growth factors are the major mediators of chronic inflammation. In acute inflammation, the tissue damage is minimal and usually it is resolved, while in chronic inflammation, there is destruction of the tissue progressively and there is simultaneous attempt at repair. Then the acute one resolves completely. Sometimes there is abscess formation or it can go on to chronic form, while the chronic is the persistence of inflammation. There is development of fibrous tissue or a scar development, or there can be development of granuloma, that is the granulomatous type of the inflammation that we are going to study in chronic inflammation. Examples of acute inflammation are acute infection of the appendix, pneumonia, that is the inflammatory process in the lung, or subcutaneous tissue inflammation or cellulitis. Tuberculosis, that is a common disease in our part of the world, is one of the chronic disease. Rheumatoid arthritis and chronic peptic ulcer are other examples of the chronic inflammatory diseases. So now moving towards the causes of the inflammation, some of the inflammatory reaction are triggered by variety of the stimuli. Some infective agents such as bacteria, virus, fungi, parasites, and microbial toxin, they trigger immune system and this lead to inflammation. Tissue necrosis, the dead tissue sends the various signals to the inflammatory cells and there is a start of the inflammation. This dead tissue can be due to process of trauma, burn, frostbite, irradiation, or as a result of some infarction such as myocardial infarction. If there is presence of foreign body within the tissue, this will result in direct injury or activation of immune response. This foreign body can be splinters, dirt, suture, urate crystals. The uric acid, when crystallizes within the joint or soft tissue, it will result in inflammation, in start of the inflammation. Then cholesterol crystals can be deposited. Lipids, as occurs in obesity, can be a pro-inflammatory state. In hypersensitivity, there is cytokine release that lead to chronic inflammation and tissue damage, as occur in autoimmune disease, allergies, immune reaction to the microbes. Physical agents such as heat, cold, radiation, and mechanical trauma can send signal that starts inflammation. The organic and inorganic chemical agents or environmental pollutant, they also are associated with toxic injuries to the tissue and inflammatory process. Finally, some inert materials such as plant implants and sutures, surgical implants or sutures, they can initiate inflammation by causing mechanical irritation of the tissue. Thank you for watching this video. If you have any question, please write the questions in comment box.